Malik. We'll start with fever today. Fever, an important topic these days. Nowadays, fever is an important topic. So we'll start with typhoid fever. Typhoid is a prominent problem since long time. It is also called enteric fever. Typhoid fever is also called enteric fever, and it is caused by bacteria. It is caused by bacteria by name Salmonella typhi or paratyphi. You call it typhoid or paratyphoid since our childhood, typhoid or paratyphoid. So Salmonella typhi or paratyphi, Salmonella typhi or Salmonella paratyphi. So these two are the organisms which cause typhoid, and the transmission is from human to human. The transmission is from man to man, like feco-oral route, from your stools, feco-oral route. Here you can see feco-oral route. That means, see, accidentally human feces get into your food or your water, the water you are drinking outside. In hotels, people carry water like this, okay, I mean in the glasses like this, 4 or 5 glasses at a time, or unhealthy water which is contaminated by the fecal matter. So this particular organism, it is spreading through feco-oral route from humans to humans, from one man to the other. So that is very, very important. There, if you can follow the hygiene, you can stop this particular thing. So typhoid fever, after the typhoid bacteria enter the mouth, through your contaminated food, after the typhoid bacteria, that is Salmonella typhi or paratyphi, once they enter the stomach, they go into the small intestine, and at the end of the small intestine, there are Peyer's patches where these organisms lodge. Peyer's patches. There, the organisms lodge and they colonize there. Once the sufficient number of organisms are there, they go into the bloodstream. Then starts, actually the incubation period is little long. It is somewhere from 1 week to 2 weeks, like that. So incubation period, the organism, once it enters the body, till it produces symptoms, till it produces fever, it is called incubation fever. That particular time it multiplies, the organism multiplies. To cause the disease, to cause the fever, it needs sufficient quantity of Salmonella bacteria, so that this is called incubation period. The incubation period is little more, but doesn't matter. So there are 3 phases: first week, second week, third week. So this typhoid fever, 3 phases are there: first week, second week, third week. First week, it will be like any other fever. Usually the fever is little low in the mornings and gradually increases by evening. It may be followed by little chills, but not severe chills and all. It may be followed by some body pains, malaise, that is body pains, a little headache, little body pains, and pain abdomen. There will be some pain in the stomach. First week of the fever, it is usually mild. That is, in the mornings the temperature will be less, and in the evenings the temperature will be more. So once it goes to the second week, the symptoms increase. The stomach pain increases. The fever will be like, there will be step ladder pattern. That means it never touches the ground. That means it never comes to normal. So morning to night, the temperature will be high. Only thing is, there will be ups and downs. For example, in the afternoon it is 104. In the morning it will be 101 or 100, like that. But it never comes to ground. Step ladder pattern, okay? It goes up, comes down, but never touches the ground. Step ladder pattern is very, very important. And gastrointestinal symptoms will be there in the second week. In the second week, the patient will look little toxic. The tongue will be coated as if you didn't clean your tongue, like that. The tongue will be coated, and there will be some gastrointestinal symptoms, like there can be constipation, or there can be loose motions. There can be little constipation, or there can be loose motions, foul smelling loose motions, greenish colored, foul smelling loose motions. Just 2 or 3 loose motions may be there, but there will be pain in the stomach. There will be pain in the stomach, and by third week, it becomes more and more severe, more and more severe. So we have to start treatment as early as possible. See, in this typhoid fever, the most important factor is, usually in all fevers, when the temperature rises, the heart rate also rises, the pulse rate. The pulse also rises. 70 to 80 is normal per minute. It rises to 100, 110, like that once the temperature rises. But in typhoid, there will be bradycardia. That means even if the temperature rises, even if the temperature rises, the heart rate will not rise. The pulse will be normal. The pulse will not rise according to the temperature. For example, temperature is 103 or 102. The heart rate will be only 90, like that. So the heart rate will not rise according to the temperature. So the heart rate will be not rising according to the thing. We don't call it bradycardia, but there will be, the heart rate will be little lower than normal fevers. So now you can distinguish normal fever and typhoid fever by this. The heart rate will not rise, the pulse rate will not rise to that extent. Okay. And what are the things? See, if the third week is neglected, particularly second week of typhoid fever, where the abdominal pain symptoms, pain in the stomach is there, and you neglect it, you allow it to go to the third week, sometimes there is a chance of perforation. The intestine can get perforated. The intestine, where the Peyer's patches are there, where the bacteria are there can be perforation, like a burst tube, like a burst tube of the motorcycle. There can be a perforation, and you may have to do surgery for it. This is called typhoid perforation. So where the intestines, in the intestines, there can be multiple small erosions, multiple small ulcers. Ulcers means small erosions. The mucosa is eroded, and ultimately a perforation can occur. We have done so many typhoid perforations in my career as an anesthetist. I have given anesthesia to so many typhoid patients with perforation, but nowadays we are not seeing them because of the developed antibiotics, good antibiotics. We are not seeing them nowadays. But in my initial days of practice, when I was an anesthetist, I have given not less than 100 to 200 cases of typhoid perforations. The small intestine gets perforated, and surgery is mandatory. So please don't go to that level. What are the tests you have to do? First week, most important test is blood culture. Blood culture will find in the first week of the fever. Blood culture is the special diagnosis. You can identify the organism, Salmonella typhi or paratyphi. CBP, complete blood picture. Widal test, also done. CBP, Widal test are routine. So other investigations also will be done, but main investigation is blood culture in the first week. CBP, Widal they do. Okay. And when it comes to the second week, Widal test becomes very, very important. Widal test is nothing but the antibodies titer of the body in the blood, the antibodies to typhoid antigen. So the antibodies, how many antibodies are there? Usually you see it in the like 1:80 or 1:160 or 1:320, like this. So up to 1:80 we can take it little casually, but 1:160 and 1:320 are very, very, very significant. This is called Widal test. Usually it becomes positive in the second week. You can't completely rely on Widal test, but Widal test is significant. Once it is 1:160 or 1:320 for Salmonella typhi or paratyphi, you have to start the treatment. So what is the treatment? Usually ciprofloxacin or ofloxacin, that is quinolones, they are very effective. Ciprofloxacin 500 mg morning evening for a period of 5 to 7 days is very effective, or ofloxacin 200 mg morning evening for a period of 1 week is very effective. In some people, ciprofloxacin, ofloxacin, they are resistant to that. Then comes this cefixime ofloxacin combination. My favorite is Mahacef Plus, that is a combination of ofloxacin with cefixime. Ofloxacin 200 mg with cefixime 200 mg morning evening. That is, this Mahacef Plus is a combination of, it comes in other brands also, like cefixime O is another brand, you can use it. So Mahacef Plus or cefixime O, ofloxacin 200 mg plus cefixime 200 mg, a combination, morning 1 tablet, evening 1 tablet for a period of 5 to 7 days, will definitely almost it eradicates the problem. So if the patient is not recovering, if the patient is having vomitings or not recovering, then you have to give injection monosef, that is ceftriaxone, injection monosef IV intravenously morning evening for a period of 5 to 7 days. Injection monosef, that is ceftriaxone, morning evening for a period of at least 7 days. And sometimes, rarely, not seen, I have not seen much cases, maybe 1 or 2, typhoid organism, it goes through blood-brain barrier also. It crosses the blood-brain barrier. It can cause meningitis. And the patient can present with meningitis symptoms like vomitings, neck stiffness, etc. Then you cannot just ignore just wait. You have to go for a higher antibiotic, like meropenem, injection meropenem. You have to go when the patient presents with meningitis. Then you have to go for injection meropenem. Meropenem is a higher antibiotic, 1 gram almost morning evening for a period of 5 to 7 days. Plus steroid also very important. Dexamethasone is usually given 8th hourly, like that. So these are the things. And one more thing is perforation. Suppose the patient comes with typhoid perforation. Already the intestine got perforated. Already the intestine got perforated. There is no other way. Immediately you have to take the patient and do to the operation theater and do surgery. Close the perforation. That is the only thing. Only thing is typhoid bacteria. See, even if the typhoid comes down, even if the typhoid fever comes down, the typhoid bacteria lodge in your gallbladder, liver, bone marrow. The fever comes down after recovery from typhoid fever, also called enteric fever. Once the fever comes down, you have recovered from enteric fever. Even then, these Salmonella typhi bacteria, these organisms, they lodge in your gallbladder, in your liver, in your bones. Previously, when I was a child, they used to say typhoid recurrence. See, those days only chloramphenicol was the drug. That was a dangerous drug, in fact. Chloramphenicol is one dangerous drug which can cause complete bone marrow depression. Now it is not given. It is completely taken off. Now there are so many medicines for typhoid. In fact, people used to die of typhoid and paratyphoid, but now we don't see that problem. We have plenty of antibiotics, as I already told you. See, after the fever comes down, after you have recovered, after you are moving, you are comfortably moving, even then you are lodging the organisms, in your gallbladder, in your liver, etc. So these organisms, they pass through your stools, they pass through your motion, and this state is called a carrier state. Okay, a carrier state. That means you are not having the disease, you are not having the fever, but you are a carrier. That means you are infecting others through your stools. You are infecting others. If accidentally your stool goes into somebody's food or some water through drainage or whatever it is, some mixture in drainage water and main pipes and drainage pipes, in from municipal authorities. So these are all the things that can happen. These are all the, you must have seen in cities, suddenly there will be an outbreak of gastroenteritis because drainage water has mixed with main pipe of water pipe. You must have seen in so many times in Hyderabad, etc., etc. So this can happen. So this carrier state is very, very important. You must be a little cautious during the carrier state. You must be little cautious